that a candidate would want to find out would be available on a website called General Dental Council UK. The exam that we took was the IQE, which involved Part A, B, and C. I believe the examination now costs anywhere between 2,500 to 3,500 pounds, which is pretty expensive. Plenty of coaching places in the UK, in India, which give help to candidates who would want to practice in the UK.
So, doctor, can you explain the exam structure? So, how a candidate should approach, which website to enroll, and what are the different parts in an examination?
So now we're talking about an exam that I took a good 17 years ago. So things have changed since. The exam that we took was the IQE, which involved Part A, B, and C. And I believe now it's only just Part A and B of ORE, it's called Overseas Registration Examination. And all the information that a candidate would want to find out would be available on a website called General Dental Council UK. So it's always reliable information on that website, and I would recommend that any person who would aspire to practice dentistry in the UK to go on that website to get all the information that they need, because it's all there, and not to go by anybody's advice or any, not from Facebook groups or such. That's the most reliable website to find the information for who to register to practice dentistry in the UK.
Also, doctor, you were mentioning about Part A, Part B, and Part C. Can you please elaborate about these parts?
So back in the day when it was international qualifying exam, so Part A involved theory of all aspects of dentistry. So it covered year 1 to year 4 of dentistry, all aspects. So it was a theory examination, post which you would have to perform a few procedures on a mannequin, and that would be Part B. And like I said, we also had Part C, which was on a patient. So you would have to perform a procedure. You're expected to perform a procedure of the examiner's choice, but you would have a choice of what to perform on a patient. But the examiner essentially tells you what to do, and you would just go ahead and do that on a patient. So that patient part is now eliminated in the current examination.
Candidate clears Part A and fails in Part B. So, what is the duration to repeat the entire exam, or should we repeat only the Part B?
Only the Part B, but it's not very easy getting another place to give the exam again, because there are very few places that are offered for the exam each time the positions open up for enrolling for the examination. So it's not very easy, and there's also a time limit within which a candidate needs to pass Part B after having passed Part A. I believe it might be 2 years, so it could have changed since, but yeah.
I believe there's a huge waiting list to cover Part A, Part B, or how long a candidate should wait for the next examination.
When a candidate is ready to take up the route of registration for practicing dentistry in the UK, they're well aware of what's involved in terms of examination and the preparation time. So it's not like somebody takes up the theory and then they take time to prepare for practicals. They would need to simultaneously practice both on the theory and the practical aspect of the examination. So there are dates which are announced on the GDC website as to when the places would open up for each part. So candidates would know prior as to when they could possibly take up the examination. But the moment the slots open up, they're taken up pretty fast. So you could miss out in the time of a millisecond. So you could be waiting another 3 months or 6 months based on when the next dates are.
Doctor, you mentioned about GDC. Can you just let us know what is GDC?
GDC is the General Dental Council, which is the regulatory body of dentistry in the UK. So you need to be a member with the GDC to be able to practice in the UK.
So, doctor, what is the expected expenditure for these exams?
I believe the examination now costs anywhere between 2,500 to 3,500 pounds, which is pretty expensive. Taken into consideration that it's not an easy feat passing these exams, it's extremely competitive. You could never say as to how much is the budget, but yes, I mean, each time they take up the examination, this is the amount they have to be prepared to shell out to pass the examination.
Also, regarding the coaching, is there any coaching institute where they can guide us to clear all these exams?
Plenty now. Back in the day, not as many because it was not a very popular thing to do for an Indian dentist because we were not even aware of such a thing existing. But now there are plenty of coaching places in the UK, in India, which give help to candidates who want to practice in the UK.
Are you aware how much these coaching centers charge?
In the UK, pretty much between £700 to £900 per day, and you could be ending up paying for say 4 days of practice.
So in these coaching centers, they cover only the theory or is it the practical session?
Yeah, no, I mean, theory you can just prepare. One can just prepare by themselves. It's pretty much a lot of questions from previous examinations, and there's a lot of books that will give you information on how to prepare for theory. It shouldn't be such a difficult job to pass the theory aspect, but for the practicals is where you have to get some sort of coaching because these teachers or the mentors, they're already dentists who've taken up these exams and they know how each person scrutinized for the examination, so it's how they guide each student for that.
So can you just give us an idea, theory, what questions they might ask?
So it's always applied dentistry. So they would never say how many branches of facial nerve are there. So they might say this person experiences tingliness on the left side of his face, and there might be symptoms of just tears rolling down. What probably could be the problem with this patient? So theory is always more an application sort of questions rather than straightforward ones.
Any dentist who's completed the post-graduation, is it valid? Is the post-graduation valid in the UK? Or
Unfortunately, it's not. Unfortunately, it's
So
not.
they have to repeat the entire procedure?
If they want to, yes, yeah. They could call themselves specialists in, or they have special interest in providing that particular branch of dentistry, but they cannot call themselves as specialist providers or anything like that.
So what made you to come back to India?
We've had a time in the UK, so family commitments made us come back. So that's when we decided to come back home and be here.
Do you miss UK days?
Quite a few times, especially when it comes to the working period. So I used to work much fewer days than I work now. So that's something I definitely miss about working in the UK.
So doctor, what did you learn from UK practice and which you still follow in India?
The standard of care, it's pretty high. It's really good. And consent taking is a very important aspect of what I've taken away from UK dentistry. Cross-infection control protocol, and the way we communicate with the patient. So we've been trained really well because nothing less than excellent is expected of a UK dentist. So these aspects are something that I've learned while practicing in the UK.
What is your favorite procedure?
Having been a postgraduate in aesthetic dentistry, I take interest in providing quite a lot of cosmetic procedures. So I do enjoy doing a lot of tooth whitening or restorative procedures involving resin restorations. Anything which is minimally interventional, I take special interest in performing those kind of procedures. And I also have a lot of liking to child patients, so I do take interest in pediatric dentistry too.
Thank you so much, doctor, for spending your precious time with us.
Thank you, Dr. Prince, for giving me the opportunity to say a few things about my experience in the UK. thank you for viewing this episode, and thank you for your interest in this episode today.
I'm sure this was a helpful session, especially for those who is planning to practice in UK. If you like this content, please do like and subscribe this channel. I'll see you in the next episode. Thank you.
Because he's a 27-year-old healthy male adult, we least expected this from him. He was conscious throughout. Only after the second episode of the nausea and the throw up that he had, and he came back and the jet position was adjusted, that's when he entered. He was almost getting into coma stage, but he wasn't entering in, but we could know that his vitals were going normal, but the patient was not coordinating much with us. Something to this extreme was definitely traumatizing everybody, and my partner was almost in chills for around a week until she saw him return back normal, and once he came to the clinic.